Our first speaker today is the author and lead sponsor of the Mental Health Parity and Addiction Equity Act of 2008. This dramatic piece of legislation provides tens of millions of Americans who were previously denied health care with access to mental health treatment. He is the founder of the Kennedy Forum on Mental Health, which serves as the vehicle to celebrate the 50th anniversary of President Kennedy's signing of the Community Mental Health Act. He is the youngest member of the Kennedy family to hold elected office when at age 21, he served in the Rhode Island State House. He served in the U.S. Congress from 1995 to 2011. And on a personal note, our guest today has the best qualities of his father, Senator Ted Kennedy. Number one, enormous loyalty, heartfelt gratitude, and a tireless work ethic. And his mother, Joan, quiet compassion and a kind heart. Ladies and gentlemen, Patrick Kennedy. Patrick? All right.
Thank you, Jay. I haven't seen this many people for breakfast in the same room since I was last over at my Aunt Ethel's house. Jay knows that because he's often over there along with other family gatherings. We love Jay Doherty and always can count on Jay whenever we're out in Chicago. And I also want to thank Peter and Mimi O'Brien, because really today would not have been possible had they not decided that they wanted to do something here in Illinois. And I am so pleased to see the response that we've had, Alderman Burke, because this is really a sign of the energy that is out here for reforming mental health here in Illinois. But it could never have gotten started if Peter and Mimi hadn't stepped up to the plate. So I looked at Alderman Burke when I was speaking here a while back because, you know, being the sponsor of such an important piece of legislation, you usually have to rise through the ranks and become a senior member with lots of gray hair, like Alderman Burke, before you get to be number one on any important piece of legislation that everyone wants to be sponsor of. So I said, and it's still the case, that you got me by default, because I was the youngest member of Congress when I was first elected, and yet, in spite of being the youngest member of Congress from the smallest state in the country and in the minority party, I got to put my name first on the Mental Health Parity and Addiction Equity Act because, frankly, there was no one out there fighting me for the honor of having the words mental health and addiction near their name. They kind of didn't think that would be good for them politically to have to explain why they were champions of mental health and addiction. So that kind of tells you what we're dealing with in this country with respect to the attitudes towards this issue of mental health and addiction. And so what today's panel is going to do, and what this afternoon's Kennedy Forum and tonight's gala are seeking to do, is to begin to change the conversation around the issues of mental health. This is not a subject simply to be concerned with those with severe and persistent mental illness, people who we see out on the streets today. It's not simply a subject that concerns people with substance use disorders like myself that affect 23 million Americans. But it's about all Americans caring about mental health, because each one of us could benefit if our healthcare system included mental health as part of our healthcare. So this is not simply about the 20% who have a primary diagnosis of a mental illness. It's about 80% of the rest of us who, with mental health integrated into our health care, we would all live healthier, happier lives. And the notion that we're here in this day and age when Americans want the best. I mean, let's just face it, you heard this competition right here between the aldermen about which district had more money. We all want more. But what we really want is we want more contentedness, more fulfillment, more sense of purpose, more sense of being and place in the world, all of which are part of what we would term mental health care. And yet, in spite of that, we do not have it within our healthcare system. And in spite of paying a lot of money to get something called health care, when that health care leaves out perhaps the most important element of our health, our mental health, our emotional health, and our spiritual health. And so I believe that we can change this. I believe because you've been so successful in organizing this Kennedy Forum Illinois, you can begin to really put Illinois on the path to being one of the leaders in this nation of establishing the kind of health care that you want here in Illinois. And so that is my hope. 50 years ago, President Kennedy, in signing the Community Mental Health Act of 1963, said, "The mentally ill need no longer be alien to our affections or beyond the help of our communities." And what he was saying was, we should not be treating people who have a mental health disorder, or anyone else for that matter, with any alien to our affections, with any stigma, any prejudice, any ill will. And the second part of that sentence was, or beyond the help of our communities. He did not simply say beyond the help of our institutions of medical care. He didn't just say beyond the help of our nursing homes or our mental health clinics or our hospitals. He said very clearly beyond the help of our communities. And really, the new frontier of healthcare is going to be bringing in the community-based support systems to our healthcare system that right now are not seen as part of medical care. But they could very well be the kind of supportive housing, the kind of supportive employment, the kind of supportive living services that are not termed medical care, but frankly have a big return on reducing the costs of medical care if you connect the mental health system to these community-based supports. And that will be our challenge moving forward, is to find the ways to pay for that care in a new way. All of this is going to take a lot of energy and a lot of brain power, which is why we're so honored that we have such great people in this room, and we'll have more this afternoon and this evening helping us in this effort. I just want to say thank you all so much for being part of this effort. This is an ongoing effort, and I think this morning's panel is especially poignant. When you think about the best way to treat mental illness is to prevent it. The best way to treat mental illness is to prevent it. And we do not in this country have a prevention strategy. And more mental illness is simply a result of people growing up in toxic environments where their brains are inalterably affected by the stress and trauma of growing up. And many of you here in Chicago know all too well what I'm talking about, given the violence that's plagued this city over the last year and many years. There's no way to have these kinds of incidents of violence and not have an effect on the whole community. I can say personally, from coming from a family that's been the victim of two gunshot murders, that my family has been irreparably damaged because of that. It was not just those victims who were my uncles, but it was their families, my family, that was affected by that violence. And it's permeated through every one of my cousins' lives and my father's life. And to think that that violence hasn't had a similar effect on every single family in Chicago that's witnessed these terrible murders in this city is to ignore the real facts of the matter, and that is that these incidences have a ripple effect that is so damaging on the whole community, and it's going to manifest itself in all kinds of mental illness and addictive disorders in the future for these young people who are growing up having been affected by this violence. The challenge for this city and the panel today is how do we intercede and help those families who've been impacted by that violence regain a sense of being and place in society so they do not feel the kind of victimhood that has been the case thus far with these tragic incidences of gunshots here in Chicago. So you have an expert panel. I have to point out particularly Surgeon General Satcher, who I'm so honored could join us today. He was the preeminent leader in this area of mental health when he authored the first Surgeon General's report on mental health. And I'm so honored that he's joining me in taking this message around the country so that we can make sure people in this country know that not only is the law of the land say that you have to pay for mental health, but let's put out what are the mental health strategies that we actually want to pay for that give us a real result and a return on our investment. David Satcher spent his life studying those strategies, and it's really about us now adopting those strategies. So I'm particularly happy that he's been able to join us today along with our other panelists. So thank you all very much, and let's move on with a great morning. Thank you.
All right, today's moderator, Eileen Durkin. Eileen, you're on.
Good morning. Imagine being me and having to follow Patrick Kennedy. So if I could ask our panelists to come up and join us over here, and while they're in the process of joining us, I just want to make a couple of remarks. Again, I'm Eileen Durkin from the Community Counseling Centers of Chicago, also known as C4. We're so fortunate today to have such an illustrious panel of local, national, and really international leaders that are going to address the major public health issue of our time, which is children's mental health disorders. Mental health disorder has an enormous impact on a child's functioning at home, in school, in the community, and we know that 1 in 5 children from birth to the age of 18 has a diagnosable mental illness. Imagine that. 20% of our children at some point in their life have a diagnosable mental illness. We also know that 50% of all chronic mental illness begins by the age of 14. So back to Patrick's point, if we can intervene early, we can change the course of someone's life. Failure to address children's mental health needs today will result in a future of increased behavior problems, poor academic performance, conflicts at home, and a higher incidence of substance use and suicide. And of course, the stigma around mental illness, along with a lack of enough community-based services, really jeopardizes the future of our youth with mental health disorders. So our distinguished panel today is going to examine how to overcome stigma and the possibilities for new approaches for children with mental health disorders. And I want to just point out that you've got a fact sheet here which will give you a little bit of information about children and mental illness, and also some information about adverse childhood experiences. And I think you're going to find this interesting, and I know that at some point Dr. Leventhal is going to be addressing this. And then I want to just briefly also add my thanks to those of Jay and to those of Patrick. We wouldn't be here today if it weren't for Peter and Mimi O'Brien, so I have to add my thanks to them, and thank you very much. And I know we all acknowledge them, but I don't think we can acknowledge them enough. It's so important. This is such an important issue, and we wouldn't be here if it weren't for the generosity and the drive of Peter. I also want to thank Alderman Burke for his interest in this topic area, and he's been a real help in moving this agenda forward. And Justice Ann Burke, who could not be here today, but the two of them have really made a difference in moving this whole agenda forward, so thank you. So let me just briefly tell you about our panel. Patrick has already been introduced, and we're actually going to throw some questions. Patrick, we're going to throw you up here on the podium, if that's okay with you. Do we have a chair for Patrick? Jay, do we have a chair? Hopefully we do. We're going to have, Paul Green's going to have a chair momentarily. Dr. David Satcher, Patrick addressed. So Dr. Satcher is a former U.S. Surgeon General, and we are so privileged to have Dr. Satcher with us all day today. And he is currently the leader of the Satcher Health Leadership Institute at the Morehouse School of Medicine. As Patrick referenced, he wrote the first ever Surgeon General's report on mental health. And Dr. Satcher, thank you for Healthy People 2010 as well. Thank you. Dr. Bashar Shakir is a family physician, and he is the commissioner of the City Department of Public Health, the City of Chicago Department of Public Health. He's developed our Healthy Chicago, our first public health agenda, real agenda, and Dr. Shakir is also has a faculty appointment at the Feinberg School of Medicine of Northwestern. Dr. Bennett Leventhal is a renowned child and adolescent psychiatrist who is the Irving B. Harris Professor of Child and Adolescent Psychiatry Emeritus at the University of Chicago. He's a leading advocate of improving services for children with mental health disorders, and he's currently working as a consultant with the Illinois Children's Healthcare Foundation, and that foundation has taken a huge interest in helping children with mental health disorders in this state, so I want to give them a shout out as well. And of course, Alderman Willie Cochran, who is with us today from the 20th Ward. He is in his second term as an alderman. Has a long bio that I was trying to collapse, Alderman Cochran. But he was a police officer for 25 years, and so it gives him a really unique perspective. Not only is he an alderman and has done community development work, but he also has that police perspective, which is really so important. So that is our panel, and with that, I'm going to actually start out first, Patrick, with you, and just ask you, why did we need the Mental Health Parity Act? Why did we need it?
Well, when you think about the most important organ of our bodies is our brain, and it guides everything in terms of our experience of life. And to think that we so disregard the brain and that we have no real proactive strategies to treat and protect the brain, I mean, it's pretty shocking given how enlightened and advanced we are as a society that we haven't done a better job at thinking proactively. Now, with every other organ of the body, we employ prevention strategies. We do everything we can to save you from having an illness of some other organ of the body, but the brain, it's like it's not there in terms of any of our approaches in terms of healthcare. So it is remarkable that it took till 2008 for us to have a law that said you can no longer discriminate in terms of insurance reimbursement or medical necessity determination practices, treatment limitations, on brain illnesses. It's pretty shocking that it took till 2008. And frankly, it wasn't until last year that the administration issued the final rule guiding the implementation of the law. So we're really only right now in the first year in the history of this country where our healthcare system has to now reorient itself to begin to think about how to protect and treat this most important organ of our body.
Great, thank you. Dr. Satcher, what is stigma and how does it impact the treatment of children with a mental health disorder?
Well, let me start by relating how we define mental health, and I'll be brief. When we did our report, we defined mental health as the successful performance of mental functions such that one could be successful in his or her work. It's also the ability to develop and maintain fulfilling relationships with other people, beginning with family, and that can be a challenge sometimes. It is the ability to adapt to change, like birth and adolescence and aging, and it's the ability to deal with adversity in one's life. So that's how we define mental health, and so mental illness was that dysfunction in which one is unable to perform in that way. There are three dimensions of stigma. One starts with the individual, and as Patrick said in quoting his uncle about alien to affection, it is shame related to who you are and what your circumstances are. It's a negative attitude toward yourself or your condition. The three dimensions of stigma begin with self, and the fact that when people who have a mental disorder are ashamed of it, or who don't feel comfortable with other people knowing that, or don't even feel comfortable acknowledging that they have it, and therefore able to seek treatment. And that's the first dimension, the individual dimension. The second dimension is sort of family and community. And that's when families feel uncomfortable with other people knowing, for example, that a child has a mental disorder. So we have families who don't seek treatment for a child when it could make the greatest difference. When Patrick was talking about prevention, it starts with childhood. It starts as early as possible. And we've had in this country for many years families who were ashamed to acknowledge that they had a child that needed help. So that, and there's a community aspect to that too, because after all, the family functions in the context of community. The third dimension is policy. If the policies are not right, then government and businesses are not doing what they're supposed to do about this issue. And I can tell you, Patrick was talking about my releasing the first Surgeon General's report on mental health in December of 1999. But you know what happens to most Surgeon General's reports? They end up on the shelf gathering dust. Unless there's a Patrick Kennedy, of course, who says we're going to work to develop the kind of policy that makes sure that our policies are consistent with the science in this report. So we define stigma as having those three dimensions: the individual, the family/community, and then policy. And I want to point out, especially to this group, business is as important as government. Businesses determine what their employees have access to, especially self-insured businesses. So that dimension is very important, and hopefully in the future, stigma will not stand in the way of making sure that everyone has access to the highest quality of mental health service.
Thank you. Dr. Shakir, what, if anything, is unique in the city of Chicago when it comes to the development of mental health disorders for children and adolescents?
Well, everybody has these sheets on these fact sheets on their table. In reality, we know that 1 in 5 kids birth, age 0 to 18, have some type of mental health disorder or have some type of mental health issues. And we know that, we see that in our schools, we see that in our practices, we see that in our families, we see that in our communities. But what's often not talked about is the impact of trauma. When we are having kids who are being exposed to trauma, being exposed to violence, this really has a lot more impact than what we think about. And it's really important to be thinking about the types of support that we would need to create in our communities to support these kids, and equally as important, support their parent as well, so we can mitigate any potential risk that we're seeing from that exposure to trauma. So for all of our families, and I want to thank the aldermen here who've been great partners to us at the health department and raising this issue and making sure that we are addressing the community impact of trauma on our kids. But I do want to point out that this is not just specific to Chicago. I know many folks here are seeing these types of impacts across the country. I talk to my colleagues in New York and Boston and Philadelphia and LA. These types of issues are really core to our urban communities, and we really have to be able to address that type of potential impact of trauma on mental health development for kids.
Thank you. Dr. Leventhal, you travel nationally, internationally, you work literally all over the world. Can you expand on what Dr. Kasher said and talk about children and their psychiatric disorders or mental health disorders?
Sure. Thank you, Eileen. First of all, this conversation seems to be a bit distant from us. This is really about you. It's not just about them. 50% of the population of the United States at some point in their life, that means 1/2 of you, will have a psychiatric illness. Psychiatric illness means you'll meet criteria for disorder and be impaired in functioning. 50%. Of those, half will have the onset of their illness before the age of 14, and 75% onset before the end of adolescence. That's you and your community. These are serious illnesses that affect the way the brain functions and how it adapts to cognition, behavior, and emotions. And it leads to problems. So, for example, about 7 or 8% of children will have attention deficit hyperactivity disorder. That means they have trouble paying attention, planning, and it affects things that they do, like driving, they're 10 times more likely to have an automobile accident. And guess what? They don't run into each other. They run into you. And yet we have very effective treatments that allow for us to successfully treat 90 to 95% of these kids. And what percentage of them get care? Less than 25%. Less than 25% of your kids are getting care. And you think it's bad, this is the United States, you think it's bad here. Go to India where they have 2 child psychiatrists for the entire country. They're a little bigger than we are. So this is not just a national problem, this is an international problem. It's an international problem, though, for which we have solutions. And that's the critical point. I think Dr. Satcher and Representative Kennedy and Shakar, we know what to do. The question is whether we can have the will and the energy and the courage to do it. And the first part of that is to stand with the kids and say, there's nothing bad about having a psychiatric illness. It's part of life. If you have cancer, you're heroic in your fight. And if you have asthma, you're heroic in your fight to deal with it. Or diabetes, pick any other medical illness. But if you have depression, well, we don't talk about that, do we? Or there must be something wrong with your mother. Or if only your parents had reared you correctly. So this is a problem where we have to start by recognizing and saying that it is our problem. Not just the half who have it, but all of us who live in this community together. And if we can start talking about it, and it's not a matter of somebody's fault, but just your brain is working differently, and we know how to fix it, we can really make a dramatic change. And we're doing it, but we need to do it on a much bigger scale and not be hindered by stigma, by poor legislation, by inadequate policies and terrible insurance policies that make us prove that these children need care. And the last thing I want to say is that about this is just think about it for a minute. If you take a 7-year-old who's having trouble in school and they don't learn how to read and write correctly because they have ADHD or they're so depressed they can't pay attention in school, even if it lasts for a year or two, the impact of that is throughout a lifetime. Then add to that adversity of whatever sort, and it becomes an unfixable problem almost. And we need to stop saying we can't fix it. We need to start now and make a difference.
Thank you. Alderman Cochran, you have a world of real-world experience. How can we help our children in Chicago with mental health disorders and trauma-related adversity? How can we help them and provide the supports that they need?
Thank you, Eileen. I think we have to create circumstances that place a child in the best possible position that it could possibly be. And that is early education, putting them in front of doctors, integrating the process of mental health assessment, just like we put them through vaccinations. When they go into a doctor's office, they should be assessed for the mental challenges that they may be presented with. Integrating that with the family, and the family integrating with that child makes it much, much more effective if those children and those parents are understanding it. And what all of the panelists are talking about is a position where we have to educate people. And we are lacking education. The children are lacking education. They don't know what kind of trauma that they're having. They don't know the side effects. And so going into the schools, going into the households, making it very possible for those children to identify and understand these are conditions that need support, and placing those support mechanisms within their families, schools, and health care, and integrating that in health care is very important.
Thank you. Jay, do we have cards on the table for people to fill out for questions? Okay, so. Okay, great. So we do have cards on the table, so if you have questions that you would like to ask of our panelists, you can hand those in, and at about 9:15 we'll give you a chance to also ask the panelists some questions. Patrick, the Affordable Care Act is changing the landscape, or it has the possibility of changing the landscape in children's mental health care. What do you see as the opportunities?
Well, the opportunity for reducing healthcare costs by actually moving our system from a sick care system to a healthcare system where we actually practice this prevention piece that we've always talked about, that we know works and that we can measure. But we've never been able to align the financial incentives around changing our paradigm of delivering care such that we invest in the kind of head start, that was started 50 years ago this next year. The concept of giving children an early start in life and to be able to wrap around the services as needed. This collaborative care model, which is evidence-based, shows that it reduces costs. So it's not just me being some old-fashioned liberal Democrat wanting to put everything in place. The business case of this is the strongest case we have. This isn't social science anymore. It's not soft science. It's hard economics. We've got the PricewaterhouseCoopers studies. We've got the Millman reports. We've got the Pew Foundation. This stuff, I can't believe it isn't being done, because if our modus operandi was to do what is more effective and costs less, we're not doing it. So that's what I think is, hopefully with a healthcare reform, when you start to wrap around whole care, there's going to be an incentive for reducing the number of acute episodes of anything. And that will also apply, of course, to mental health. And the other last point I'd say is mental health is seen as the value add in the rest of healthcare. In other words, you look at all the big costs of diabetes and cardiovascular disease and so forth. All of that can be improved dramatically, pain, if you address the mental health of the patient. And so that's the real exciting news for our community, is that we're going to be seen as having the answers to the rest of physical health. And that will be the real revolution in this, is when people don't see mental health as just something that we talk about for people with severe mental illness with a primary diagnosis. But when we talk about mental health as something for everybody to benefit from, and embed mental health seamlessly through our healthcare system and not have it as a separate and unequal system, which is currently how we view mental health. It's kind of something over to the side.
Patrick, thank you. Dr. Satcher, how do we use the Affordable Care Act to actually prevent mental illness? How can we do that?
Well, I think the Affordable Care Act, in several ways, gives us an opportunity to really enhance the prevention and treatment of mental disorders. And I do want to just say that the early treatment is in and of itself prevention. The brain development is very active very early in utero, and certainly between the 10th and the 16th weeks, major brain development. And that's when a child exposed to toxins or inadequate nutrition or violence in the family, and they are exposed, by the way, even though they are in utero, really suffers. And on the other hand, when they're in a very positive environment, the brain development is enhanced. When we did the report on social determinants of health with the World Health Organization, we said that the good nutrition and strong positive environments virtually scup the developing brain in utero. And it's true. We have to make sure that children are exposed to positive environments as early as possible, but also exposed to quality health care. At the Satcher Leadership at Morehouse School of Medicine, we have a quality parenting program. So we work with about 100 parents a year, and the whole focus is on child development 0 to 5. Not just about the kind of health care they need, but the kind of parenting they need and what parents can do to give them a healthy start. And our population, probably similar to much of Chicago, 80% of the parents are single parent households. Now we're trying very hard to get more fathers in this program, but you know that struggle. So I think the foundations for mental health are laid very early, and if they're not laid properly, then the child suffers and the rest of us suffers. I mean, we can talk about mass shootings in this country when everybody seems to get concerned about mental health. I was involved with the first Columbine shooting. I remember as Surgeon General how traumatic that was. But when I look back over the last 10 to 15 years, we've had less than 200 deaths from mass shootings. How many have we had in Chicago when young people kill each other every weekend or during the week? That too is a mental health issue, because remember the definition, it relates to fulfilling relationships with other people. And if we're developing our children in an environment where they don't have the ability to develop and maintain those positive, fulfilling relationships, then we are not contributing to their mental health. Now, yeah, when they drop out of school, we know that they're going to probably be in prison before they're age 30, and so we build prisons, but it doesn't solve our mental health problems. And so what we need to do is to really make a commitment as early as possible to children to make sure that they have quality parenting, but also access to the highest quality of mental health care.
Dr. Leventhal, could I ask you to talk about adverse childhood experiences? Because I think that follows right along with what Dr. Satcher just talked about.
So human development, as we know, is a rather complex set of phenomena. Genetics plays a very powerful role in it, but it's not the whole story. I think actually it's important for us to remember at some point we don't actually want to talk about mental health. We want to talk about health care, and that the brain is actually part of the body. I know that may be shocking to some people. And it's actually important to know that the basic physiology, we have a genome that has 3 billion base pairs, about 22,000 genes. We have about the same number of genes as worms, and cows actually have more genes than we do. So there's something special about us, particularly when you realize that half of the genome, half of the genes are expressed in the brain, and 25% of the genes are expressed only in the brain. So somehow, how the brain functions and works is very important to have that much emphasis on it from our basic biology. But we also know that genes don't work alone, that they interact with the environment constantly, and genes do different things at different points in time. And early in life, the functions of the genes are to create us in whatever form and shape we take, but also to prepare us to deal with the kinds of things that we experience in life, both good and bad. The way those genes come to be expressed has to do with the experiences that they have, whether it's nutrition or whether it's kindness and all the positive things that we know about. And by the way, these things don't actually begin in utero. They began as people begin to prepare to be parents. So how someone approaches parenting, having a child, then going through pregnancy, and then actually living their lives. Adverse childhood experiences, ACEs, and you have a very nice booklet about that on your chairs today, is a different approach to understanding how environmental factors play a role in gene expression. And I want you to understand that while adversity is important, it's also good things are important, and it's the balancing of them. We all face adversity. The capacity to adapt to adversity is really what's critical. And what's adverse for one person may not be adversity for another person. And we have to look at it at the level of individuals. And our goal, we know that as you increase the number of adverse events you have, beginning in utero, the risk for developing all manner of problems, including psychiatric illness, but also medical illness. So for example, if you were exposed to cigarette smoke as a fetus, that is, your mother smokes or your father smokes, remember the environment we share the air, or your aunts or uncles smoke, or you work in an environment where there's smoke, that nicotine gets transmitted to the brain, and it affects the way the brain develops. And it leads to a whole group of problems in later life. But it's not just the brain that's affected. There's also increased risk of asthma, and there's increased risk of heart disease associated with being exposed to the adverse effects of smoke. Or you can add to that almost any other environmental factor. So environmental factors change the way we live and develop. And our whole goal is to try to minimize the number of adverse events and to increase the number of positive events. If you have a very high level of adversity, the risk of a bad outcome rises. Certainly things like violence and murders are critical, but those are they're all too common, but they're relatively rare events. Abusive parenting, poor school teachers, and many other factors like stigma or bullying are much more common and really have adverse impact on children that lead to much higher risk for psychiatric illness, but also much higher risk for other kinds of medical conditions as well.
Good. Thank you. Dr. Shakir, just tell us a little bit, if you could, about mental health services for children in the city of Chicago.
Sure. So, for years, the city of Chicago focused its mental health services on providing mental health for adults with mental illness. And for the longest period of time, that was the most important service that the city could offer, because there weren't enough providers in the community providing mental health services for adults. But as the systems improved throughout the city, we have a list of over 200 locations where people can access mental health services throughout the city through not-for-profit providers, community mental health centers, and others. Really, this allowed us to reform our own clinical systems as a city, which allowed us to really focus on prevention. And Congressman Kennedy mentioned that the best way to treat mental illness is really to prevent it. So by making the reforms for our own system, we were able to really focus on prevention. So 3 quick examples. We've partnered with the Illinois Children Healthcare Foundation, and I know Heather Alderman is here today, the president of the foundation, and with Alderman Cochran, and with Erie, C4, Metropolitan Family Services, and Mile Square, to invest over $4 million to really look at how do we integrate mental health and primary care services in the primary care clinics. Parents bring their kids to the doctor to get their school physical, to get vaccines, to get all the, for colds and flu symptoms. So by creating systems where these kids could be getting behavioral health screenings, could be entered into receiving mental health services as needed, it really eliminate a barrier to access to behavioral health screenings. So through this investment with the Illinois Children's Healthcare Foundation, literally tens of thousands of kids on the south side, on the west side of the city, will be able to access behavioral health screenings. And we're really excited about that type of investment that's really critical. Another pilot that as soon as our city council approved the budget for next year, we're allocating additional funds to provide mental health services for kids who are victims of sexual assault. Again, unfortunately, we do have wait lists for those kids. And as a society, what does it say about our values when we know that kids who've been victims of sexual assault had to be on a wait list to receive services? So through this additional investment, we're going to eliminate that wait list. And a third new investment, and also in awaiting our alderman approval of our budget, is an additional investment in restorative practices in our elementary schools. And I think we've all been talking about adverse exposure. We've all been talking about the importance of these services within our schools, so we're going to be able to expand restorative practices in our elementary schools. So when these students are exposed to all kind of different types of disruptions, violence, all kind of problems within these schools, we have the right practices in the schools where we really engage the parents, the students, the teachers, and creating the right environment, so hopefully we can provide those kids with the better tools that they need so they can deal with these issues and don't eventually develop to requiring mental health services as they grow up. Again, the main focus is really how do we prevent mental illness? This is the best way to treat it, and that's the new shift that we've been focusing on as a department over the last few years.
Thank you. And Alderman Cochran, how can you support the work of the City Health Department?
Well,
As an elected official,
yes,
of course.
vote.
how can I support it as a policymaker? I can emphasize the importance of funding. I can emphasize how important it is to put a stress situation that children are going through and compare that to a disease. And when we look at the trauma that is going on out in our communities today, the disease is at an epidemic proportion. And if we don't get a handle on that right now, and look back at 1980, when President Reagan took his pen and made some changes in putting resources into mental health. And the disinvestment in the resources that we have had to address those issues that are dealing with our communities, then we continue to fail. And so it behooves us all to look back on history, understand what impacts we have today, see this as a disease that is an epidemic proportion right now and will get to be even greater. We talk about Ebola, and what are we doing? We're blaming people. We're saying that there should be better responses, but we're not paying attention, and we're falling asleep at the wheel at something that is affecting all of our families and all the circumstances that we are associated with. Education is important, but you can do everything you can for a child in their education. And when they leave out of that school building and their world is crumbling down around them, the education that you provide them is not being as impactful as it should be. And so we have to look at this as a whole organism. We have to look at it as putting the money into we have to put the money where our mouth is and do something about it. And each one of you all, we want to be an advocate for this, because the more we talk about it, the better off we are. Dr. Shakir talked about how he and I had been engaging with Metropolitan, C4, Mile Square. Well, that comes from our conversations. It comes from my talking about these things in the budget hearings, and as a first responder, seeing what kind of impacts it had. As an alderman, going out to these crime scenes and going to families' homes. It is a traumatic experience that people don't know how to deal with. And if we don't do something about changing it around, it becomes a normal way of life. And we don't want that to be normal, do we not? Because you can do everything you can and put your children in the best situation that they could possibly be. And you know what? Somebody who has not had the resources and the attention paid to them the way that they should could victimize you and your family in a way that you just don't understand. How many times have we heard people say, this just is not normal in this neighborhood? That is epidemic, and that is something that we have to address.
Thank you. And we have a couple of questions we have to wrap up in a couple of minutes, but one of I'm going to put these two together. The assessment of the state of Illinois services for mental health disorders, especially for children. And we actually have Dr. Lori Jones with us, who I know is making a lot of plans, and Lori is the governor's office for mental health services. So Lori, just briefly, what are we doing in terms of children's mental health services? I know you've got a lot of plans on the books. We're going to put her on the spot. You're welcome. Dr. Jones, thank you. All right, so we've got a few more questions they have to do with police departments and training and so on, but I know we also need to clear this room because I'm getting the signal. So we're going to wrap up, and Patrick, I'll have you last. Dr. Leventhal, final comment.
Just think about it for a minute. If someone said that children with cancer had to be on a waiting list for care, how many of you would be stomping your feet, screaming and yelling? And we have children who are sexually abused and have to be on a waiting list, or any other psychiatric illness, and they have to be on a waiting list, or an insurance company says, we're not paying for that. You know, if you do nothing else today but walk out of here being outraged at the state of affairs and not saying this is partly your problem, for which you have to have solutions. If you don't go talk to your company and say, what are your benefits at your company? Or if you don't go talk to your neighbors and say, what are we doing in our community? You're not really feeling the reality of what is a serious set of illnesses that can be fixed. And we can do a lot with this in the healthcare system and in our communities, and we need to do it. We are here and ready to help you. The clinicians are ready. We need the support and the assurance that the resources are going to be there, because they've got to be there. There's no choice. This is not an option anymore.
Dr. Leventhal, thank you. Dr. Shakir, final word?
You know, I want to point out that resources are usually not limitless. We have a certain number of resources that we have to invest in. And in reality, unless we start thinking about how do we put these resources in early childhood interventions, how do we put these resources in improving the system overall so we can prevent mental illness, we're never going to be able to catch up. We really are never going to be able to catch up. So we have to have the courage to reallocate resources where the need is. And I'm so glad that this conversation here has brought up the importance of allocating resources to improving the system so we prevent our kids from developing mental illness as they grow older.
Good, thank you. Alderman Cochran?
It is extremely important to integrate child care at a very early age, early childhood development. Not just child care, or I have to say early childhood development. At a very early age, 6 months, in a very caring environment, and integrating families into that. When we do that, we impact the whole entire family. Identifying and educating the public to what this situation is, and providing a means by which that education can be delivered. Working with first responders and having crisis intervention teams available to those communities that are in desperate need of it. I would say that by doing that, we take this disease and we change the epidemic of the disease, and we come out on a positive end in some years in front of us, looking at the past, understanding where we are at today, and doing something to address it for our future generations. That is what I want to be taken out of this room.
Thank you, Alderman Cochran. Dr. Satcher?
I was just thinking about, after we released the first Surgeon General's report on mental health, got calls and letters from people all over the country who, number one, who was thanking us that finally the Surgeon General's office was recognizing mental health as a significant issue. One of the letters I remember most, and I think about it a lot, is a young man who wrote me saying that when he was 8 years old, his mother committed suicide, but nobody would talk with him about it. In fact, they never even admitted to him that that's what had happened, but he knew, and he was just frustrated throughout his life that nobody ever talked about it. And he said to me, Dr. Satcher, I'm going to call a family meeting next week, and we're going to revisit what happened to my mother, and we're going to talk about mental health. Well, when I was a student at Morehouse, I used to go to Ebenezer Baptist Church whenever we knew that Martin Luther King Jr. was speaking. And so people ask me today, what was it so special about Martin Luther King speaking? And I always say, well, he had the ability to educate, motivate, and mobilize people better than anybody I've ever known. But that's what you can do too, and I think when you leave here today, first and foremost, you need to take it upon yourself to educate people about mental health and mental illness. But you also need to motivate people to seek the behaviors and the care that they need, and even mobilize communities to make changes in our system. So educate, motivate, and mobilize when you leave here today. Thank you.
Thank you. And Representative Kennedy, you get the final word before I turn it over to Paul Green, who is over there telling me.
Well, first of all, thank you, Eileen,
Thank you.
for all you've done. And
Yeah, thank you.
thank you, Eileen. So growing up in my family, having read the history books about what a transformative time the 1960s were in terms of changing the course of our country, It's hard for me to begin to appreciate what it must have felt like back then when the change was happening all across this country. But I think we're in a period of time where that kind of fundamental paradigm shift and change is now upon us with respect to mental health. And just like Dr. King talked about ending the segregation of people simply because of the color of their skin, we need to end the segregation of people in this country simply because their illness is of the brain. This is a movement not only for medical care, but it is a movement for human dignity, just like the civil rights movement. And so I hope you all appreciate this is not just about fighting for more resources in order to get care and resources to people who need, but it's about making sure we treat one another with the same dignity that we ourselves and we want our families to be treated. That's the essence of what made the 60s so great in terms of the march to social progress, and I think that's going to be the essence of what this new civil rights movement is going to be all about. And I thank you all for being here today to be part of it.
Thank you.